Everybody, and welcome again. Thanks for making it, and welcome to thanks Representative Bowen and Congresswoman Moore for joining us in what we've all realized is kind of our new normal for meeting, but appropriate normal. I'll be brief. As always, the message is stay safe, stay at home, and save lives. The count is up again, not surprisingly. I expect Commissioner Kiwala can talk a little bit about the specifics of where, as she did before, but I'm concerned about the fact that a very big chunk of the growth of cases continues, at least in the city of Milwaukee, to be in the African-American community, which is something that we should be addressing in every way we can. But obviously, as I always say, this is as serious as anything can be, and it really is about saving lives. We have to think about each other in these times as a family. We get out of that habit sometimes. This is a good time to remember all of our interdependence. But if we commit together to staying at home, we absolutely will be saving lives. So with that, I will turn it over to Mayor Barrett.
Thank you very much, County Executive. I'm very pleased that we're joined today by Congresswoman Moore and Representative Bowen. But before we turn it over to them, I want to just talk a little bit. In the last 24 hours, nationally, we have seen some very strong comments from Governor Cuomo of New York, because New York City and New York State has become really the center of this in our country. Now, for some people, that might lead them to conclude, well, it's a New York problem. But bear in mind, it was not that long ago that we thought it was a Chinese problem, and then we thought it was perhaps an Italian problem, and now we think of it as a New York problem. All of those should be indicators to us that we are not in any fashion immune from any of this whatsoever. And we're seeing that, because I want to remind people that it was Friday the 13th, March 13th, when we had our first diagnosis. And now we're over 250 for the city, and the numbers are rising for the county as well. And so that was just 12 days ago. So it has dramatically increased. Today is the first day, of course, that both the city and the state stay-at-home orders are in effect. And I want to stress what that means once again, so people know that. This is not meant to be a military action. This is not meant to be martial law. This is meant to be a public health safety measure, because we know that the distancing, the social distancing, is the best defense that we can employ right now. And I use that word purposefully, because that's the defense. We know very, very quickly we want to pivot to the offense, and that is the issue of having more testing. That means we're doing everything we can to get more testing and isolation for those individuals who are testing positive. Because if you look at the countries that have been most successful in dealing with this problem, they're countries that have done a lot of testing, and they work on the tracing as well as the isolation. Unfortunately, because of the way this has unfolded in the United States, we have moved to the defense before we could really go on the offensive. That doesn't mean that we shouldn't. In fact, I'm going to continue to push. And if you heard Governor Cuomo's very, very powerful and very, very passionate plea for ventilators, I hope that we don't get there. But my fear is that we are days away from that as well. So now the focus, in addition to having people socially isolate themselves, and in addition to getting the personal protection equipment for all of our frontline responders, we have to start focusing also on making sure that we've got the capacity in our hospital system and any other ancillary places that we're going to house people. And that's something that we've worked very closely with the county with. The state obviously has been very, very involved in this as well. I also think it's important that we get an update from Congresswoman Moore about what's going on in Washington and about the prevalence that County Executive said here in the city of Milwaukee. What we have seen is we have seen no part of the city immune from this. No part of the county is immune from this. But at the same time, we must acknowledge that we are seeing a relatively high prevalence on the northern part of the city of Milwaukee, where our African-American population lives. What does this mean? This means that I think people are living more closely together. There are social determinants of health that might put people more at risk, the poverty, the issues that we face in housing, which have people living more closely together. We have to be mindful of all of that. So this is in no way a criticism of the hygiene. This is in no way saying making any sort of value judgment. And I think when you hear Representative Bowen talk about how he felt that he contracted this, you'll have a better understanding why we talk so passionately about the social distancing, because I think that is so critical to what we're trying to do right now. So with that, I'm going to turn over to Congresswoman Moore, and I want to thank her for all the work that she's doing. She's in obviously a challenging situation, but she has been there time and time again. Every time we've needed her, she's been there. So Congresswoman Moore, the floor is yours.
Well, thank you. I hope that I am cued in. What do I need to do? Can you hear me?
We can hear you very well.
We can hear you. You might want to tilt your camera down.
Yeah.
Okay. Uh-oh, what did I do?
We can see more of your face. We want to see more of your face. You're sort of at the bottom of the screen, Congresswoman. There you go.
Hi, David. I really am glad to see you doing well. I'm very disturbed by the fact that we have seen such a prevalence of the COVID-19 virus here on the north side of Milwaukee. When you hear folk talk about it as some sort of Asian trope, the China flu, there aren't many Chinese people in our community, and yet we see this disease here. So we have to take it very seriously. And I just want to say to all of my beloved friends and constituents, I literally I've sort of lost count of the numbers of contacts that I've had with people who were later diagnosed with COVID-19. And so I really am taking the stay at home a message to heart because I have an underlying health condition myself. I am doing very well on oral medications, chemo treatment, but what this means is that I have a deficient immune system. And so I'm really glad I resisted asking you to bring me a bottle of red wine over, Representative Bowen, to discuss the politics of the day. But on a more serious note, social distancing is very, very important. I do think that we need to look out for the elderly, look out for people in our community. That's a good reason to go out. But I'll have to tell you, my daughter took me on a run to a drugstore, a pharmacy, to take medication to someone. And honestly, she had a bucket of water in the backseat of her car with a rag soaked in bleach. And as I got in and out of the car, she made me wipe off the handles, the doors, the gloves I had on with bleach. And so, you know, as she was rushing around looking for hand wipes that were no longer available, she improvised and put her a few drops of bleach and some water in her car. And because, you know, there are a lot of people who can't afford to become ill. We're just very happy to know, Representative Bowen, you're going to be immune pretty soon and you'll be back out in the community helping all the rest of us make it through it. I'm really, really pleased that we seem to have come to some agreement in D.C., perhaps on a package that will provide about $2 trillion in support, not only for people who are on unemployment insurance, but monies above and beyond that for families. And no, it won't be limited to just people who have income tax liability. Those folks who find the bars and restaurants shuttered, those people who sing for a living or perform for a living and can demonstrate that they have lost the resources from their own private businesses or folks that we're looking out for. And there's a $2 trillion package. There was a lot of concern about $500 billion of that being monies that essentially would be a slush fund to provide for businesses as opposed to being strategically used to make sure that people could retain their jobs. But of course, so I want people to take that sort of good news that help is on the way so you can stay at home. There are moratoriums we're putting in place against evictions. So to make sure that we have resources so that I think the mayor can tell us about whether or not utilities are going to be able to turn off services. And so I want people
We're having
I
some
think we're having some
issues.
technical problems with Congresswoman
Yeah,
There's the
Just
audio
locked
back
up.
now, Mayor.
Yeah, I can't hear her either. Kind of just
So why don't we shift to Representative Bowen? And Representative, I don't know how comfortable you are, but the story you relayed to me, I think, is a pretty powerful story about social distancing. But the floor is yours.
Sure. Thank you, Mr. Mayor, and thank you, County Executive Averly. Members of the press, thanks for joining us today. I think I really want to just hit home how important it is for folks to take heed to the note of our mayor, of our governor, to stay home. It's very clear in just interacting with folks and not knowing that they actually have already been exposed to the virus, or that you're exposing yourself to the virus. I exposed myself as well, connecting with a local elected official out of the village of Shorewood. Days later, I got a call from the village of Shorewood Health Department that I was in contact with an individual that had direct exposure to the virus, and really did not think anything of it. You see a friend in a cafe, you sit down, you talk, and by the end of that conversation, it is a lot more dangerous than a lot of us think. And so from this exposure to the virus has led me to end up being positive for the virus, going through symptoms that are very intense. And I think there are a number of people in our community that are not taking it as seriously as they should. And it's important that we really hit that home, that it's very important for folks to take heed to those calls, to distance themselves, to stay home, to stay with their families. If it is not an essential for you to head out of the door, something that has nothing to do with groceries or essentials with medical needs, please make sure that you are staying home. We are seeing a concentration of the virus among the north side of the city, and especially with Black men. I had a conversation with Reverend Lewis as well earlier today. He also has contracted the virus, and he is recovering. But there are so many individuals that might not be able to handle these symptoms and survive, as we know that the health complications can be there and can have devastating effects. So my mentor, Leonard Wells, who also contracted the virus, did not survive that as well. He served formerly on the Milwaukee Police Department and in leadership for our community. So prayers and thoughts to his family. We want to make sure, as somebody that has experienced the virus, that we are doing everything we can to hit home for folks to really take heed to these calls and to take care of themselves. If they are experiencing those symptoms, please contact your medical provider as soon as possible. Thank you, Mr. Mayor.
I just want to emphasize again, when I talked to Representative Bowen, and he made it clear to me that he is very, very good at washing his hands. And
very unstable connection.
He's been very thorough in washing his hands. And I've got to believe, Representative, that you never dreamed that just sitting down in a coffee shop with someone would be the interaction that would do it. And I think there's a message there. It wasn't as though you went to an event with thousands of people or even hundreds of people. That's why this whole notion of social isolation is important, because what we're seeing is even within families, it can be spread because someone brings it into the house. And so if you're visiting your grandchildren or you're visiting your grandparents, I read a story last week about a family in New Jersey that got together every week for dinner. The mother was 74 and it was a big Italian family, and they'd have the whole family over every week. And somebody brought it into the house, and within days, she had passed away and 3 of the 11 kids had passed away. So again, it's limiting that social interaction as much as we can to slow down the disease. So again, thank you, Representative Bowen, for your insights, because I think they're very, very important. And obviously we all are praying for your very swift recovery. With that, let's go to the commissioner. I think Commissioner is on the phone as well.
Good afternoon, everyone. Thank you, Mayor Barrett. Representative Bowen, it's good to see you. I know last time we saw each other was at the Molson Coors Vigil. Unfortunately, the disaster brought us together. But would you be willing to talk about how your symptoms started? Because I think there's a lot of questions in the community how it presents itself. And I know it's a little different for each person, but I think that'll be helpful for the audience.
Yeah.
Sure. I can definitely provide some insight. It started for me with body aches and, not being able to get warm. I literally was walking around my home with a winter hat on, with the heat on blast, and still could not get warm. So it is very important that people take note. Once those body aches start, the fever started next for me. My fever went up to about 103 degrees. And literally your body is super hot, but you feel cold. And the coughing, the respiratory restrictions you start to feel the tightness in your lungs. Thank God I do not have asthma, but there are a lot of people in our community that do, or that have other respiratory ailments. So we definitely want folks to be careful on the symptoms can have pretty mobilizing effects.
Thank you for sharing that. I know you're still going through your isolation period, and whatever we could do to support you during this time, let us know. Okay.
Absolutely. Thank you, Commissioner.
Yeah, you're welcome. So for the city of Milwaukee, right now, we are at 248 cases, and the county's at 330, 248 just for the city of Milwaukee, but total 333 for the county. We're continuing to follow this updated testing protocol per the state, which helps us to focus on the people that are in the hospital, making sure those people are getting tested, because that helps dictate what types of treatment will be available for those individuals, and then individuals that are healthcare workers. So those, again, are the priorities for testing. I know that there are a lot of concerns about access to testing, looking at South Korea, as the mayor noted too, having more widespread testing. We know a lot of this is related to what is allowed and what is coming down from the federal level. Things also have to be approved by the FDA. We can't just roll things out haphazardly. I know that there's other technologies coming to be able to spread testing out to be more widespread. I do know that there are a number of comments and concerns about certain individuals based off of their status and celebrity being able to get tested versus, us common people. So we are raising those concerns. We are questioning, more of us, we need to know what's going on, and the logic of, if you have these symptoms, as Rep. Bowen noted, you should consider yourself infected. That's true. But also why, spreading the net for testing is going to help us have a better sense of where we're at as far as numbers. We are bringing on additional support for epidemiology. Thankfully, my alma mater, the University of Wisconsin-Milwaukee, and Dean Ron Perez have stepped up to be able to provide additional epidemiologists and faculty that have an emphasis on biostatistics to come and help us analyze this data a little bit better. We want to be able to understand a few things. One, again, looking at over half of the cases are in the African-American community. And why is that? Is that due to comorbidities? Is that due to some other factor as far as where people congregated or some event? So we're trying to understand it a little bit better. So there'll be more information about that. So stay tuned for that. Also, the Milwaukee Health Department's lab, again, is doing testing. And we currently have tested, as of when we started, which was the 5th of March, 912 patients have been tested, and that includes about 977 specimens. Sometimes one person might require multiple swabs, so that's why you see a variance in the number there. But the difference between yesterday and today is the positivity rate has increased by about 3%. So we're about 15.4 0.4 positivity rate, which means we're seeing more. We're also seeing that males have a higher positivity rate between the ages of 25 and 64. I know CNN released an article about males and risk for fatality related to COVID-19. So that's something that is being researched. It's still too early to call or make a correlation. There needs to be more research to be able to make those connections. But again, there are a number of individuals in the academic and scientific community that are researching COVID-19 to help us better understand this disease. Again, it started in December of 2019. So it's still pretty early. We're really, really focusing on suppressing the incidence of COVID-19 in our community, which is why we have this safer at home order that's now in effect. Again, there's other features of social isolation. There's some exemptions. So religious services now are added back, but you have to have less than 10, and you still have to maintain 6 feet in between each person. And of course, the cleanliness and all the other hygiene that comes with that, your personal hygiene, in addition to making sure surfaces are sterilized in between services, for instance. The health department has received many requests and concerns and praises over the last day. And I just want to continue to highlight the need for credible information. We are working on launching a campaign targeting the African American community, and through the Unified Incident Command or Emergency Operations Center through the county and city, there is a campaign that is prepared to be launched that will be providing some more targeted efforts for various communities in our area. But we understand that there needs to be more robust communication, so we are working on that. And then also there is a frequently asked questions document that was prepared by our staff at the Milwaukee Health Department, and other health departments in the area are working on documents as well, in addition to the county's Emergency Operations Center. So we're trying to answer some of the questions that we're seeing trends of, for instance, for essential businesses. Like if you qualify as an essential business, you still have to maintain social distancing. You still have to make sure you're staggering schedules, that staff are not sitting, so closely to one another, that there's 6 feet distance, stepping up the cleaning and the hygiene, and then also, most importantly, monitoring staff before they're coming into the office. There are various forms that can be used to be able to make sure there's accountability there, but also checking for fevers before people come into the office, if they need to come into the office or factory or whatever work setting, but that they're not coming in and exposing others to COVID-19 as it is extremely contagious. So again, thank you for the opportunity to provide this update. I'm glad to see Representative Bowen doing well. His beard is still strong. So thank you. Yes, and Congresswoman Moore, it's always a pleasure to see you, and County Exec Abley and Mayor Tom Beard. So thanks.
Thank you, Dr. Kawhi.
Congresswoman Moore, welcome back. You cut out at halfway through. If you want to come back.
Hi, Howard. I don't know where I left off. I was probably just sort of babbling, and I think I touched the wrong thing. Can you see me?
Yeah, we can see you very well.
Okay. Well, all I wanted to say is that, I did have to go out
to the drugstore, and I don't know whether you heard this part, but my daughter had a little bucket with bleach in it and a terry cloth towel where, I wiped the doorknobs of the car, put leather gloves on, and went into that store and came out and wiped. And so people cannot be too careful if they have to go out. But it just makes you sort of think about, what you have to do. And I just want to just wrap up again by saying we're working on an economic recovery relief package for all kinds of workers, even those people who have not had any income tax liability, don't file taxes, people whose businesses have been closed because of the furloughs, no fault of their own. We're, rent moratoriums. And so I want people to feel reassured that they can stay at home and just stay put and trust that And we're all working very, very diligently to make sure that that we get through this wave. And I just want to reassure people that that staying at home is going to be a good thing. We're going to make sure that staying at home is something that we can make as low the misery index with money.